What if I told you that something you did last night, something completely ordinary, something you've probably done thousands of times without a second thought, could be slowly setting up the conditions for a fatal heart attack while you sleep? Not someday, tonight. And what if I told you that the people who are supposed to protect your health have known about it for decades and said nothing, because silence is worth billions of dollars to them? I know that sounds dramatic. I know it sounds like the kind of thing people say to get your attention. But by the time you finish reading this, you're going to understand why I mean every single word, and you're going to know exactly what to do to protect yourself starting tonight. My name is Dr. Leonard Javier, and I've spent years reviewing the medical records of patients who died suddenly in their sleep. Heart attacks that struck between 2 and 6 in the morning, when the house was quiet, when everyone was unconscious, when there was no warning and no time to respond. And what I found in those records, over and over again, was something that made my blood run cold. These deaths were not random. They were not inevitable. They followed a pattern built out of habits that doctors never warned these patients about, habits that the medical system quietly tolerates because treating heart attacks is a $90 billion industry and prevention doesn't pay anyone's salary. Tonight, I'm going to walk you through 7 nighttime habits that are increasing your risk of dying in your sleep. Not theoretical risks, not distant possibilities, real, documented, peer-reviewed dangers that are quietly operating inside your body right now, every single night while you sleep. And I'm going to give you specific, practical, completely free changes you can make starting tonight that clinical research shows can reduce your overnight heart attack risk dramatically. Some of these changes will take 30 seconds, some will take a little more adjustment, but none of them require expensive prescriptions, none require surgery, and all of them are things your doctor should have told you years ago, but didn't. Let's start with habit number 7, because this one alone could be the difference between waking up tomorrow morning and not. If you're over 65 and you're on blood pressure medication, there's a very good chance you take it in the morning. Your doctor told you to. The prescription label says to. It's just what everyone does, right? Here's what they never explained to you. Your blood pressure is not static. It follows a natural 24-hour rhythm, rising and falling throughout the day in patterns your body has followed since birth. During sleep, your blood pressure drops. That's healthy. That's normal. But in the hours just before waking, between 3 and 6 in the morning, your body releases a surge of stress hormones like cortisol and adrenaline to prepare you to start the day. In healthy people, this surge is gentle. In seniors with high blood pressure, especially those over 70, this surge becomes a dangerous spike, one powerful enough to rupture weakened arterial walls, dislodge existing blood clots, and trigger massive heart attacks while you're completely unconscious and entirely unaware. Now, here's the part that makes this devastating. That morning blood pressure medication you took with your breakfast, it's wearing off by midnight. By 2 in the morning, it's completely out of your system. You are entirely unprotected during the exact hours when your heart is under the most strain. A study published in the European Heart Journal followed over 19,000 adults with hypertension for more than 6 years. Researchers split participants into 2 groups. One group took their blood pressure medications in the morning, as standard practice. The other group took the exact same medications at the exact same doses, but at bedtime. The only difference was timing. The bedtime group had 45% fewer cardiovascular events. Their risk of dying from a cardiovascular cause dropped by 66%. 66% just by taking the same pill at a different time of day. That study should have been front-page news. Every cardiologist in the country should have been calling their patients the next morning. The FDA should have mandated changes to prescription labels. Instead, the study sat quietly in a medical journal that the overwhelming majority of patients will never read. Why? Because there's no money in telling you to take your existing pills at bedtime. Nobody can patent a new dosing time. Nobody can charge more for it. No pharmaceutical rep can promote it. So the information just sits there, saving no one, while people like George keep dying. George was 73 years old, retired postal worker from Nevada. He walked 3 miles every single morning. He took his blood pressure medication religiously at 7 a.m. right after breakfast, just like his doctor told him to, for 12 years. One Tuesday morning, his wife found him unresponsive at 5:30 a.m. He'd had a massive heart attack sometime around 4 in the morning. George survived, but he's not the same man anymore. He uses a walker now. He gets winded climbing a single flight of stairs. He can't drive. His cardiologist told his family, these things happen. He's 73. The heart just gives out sometimes. But when I reviewed his case, I saw something completely different. His medication was perfectly dosed for daytime blood pressure control, but his 24-hour monitoring showed massive spikes between 3 and 6 in the morning, readings of 180 over 110, while his medication had fully worn off. His heart was completely unprotected during the most dangerous hours of the day, and not one person, not his primary care doctor, not his cardiologist, not his pharmacist, ever mentioned that bedtime dosing might save his life. That's not just an oversight, that's negligence, and it's happening to millions of seniors right now, tonight, while they sleep. The medications that work best at bedtime include ACE inhibitors, ARBs, calcium channel blockers, and many beta blockers. Most blood pressure medications can be safely moved to bedtime, though some need to stay in the morning, which is why you need to have this specific conversation with your doctor. Ask about the Hygeia chronotherapy trial, the European Heart Journal study I just mentioned. It's peer-reviewed, large-scale, definitive research. If your doctor dismisses it without explanation, it might be time to find a doctor who actually reads the current literature, because one who ignores evidence this strong isn't practicing medicine, they're practicing complacency. But medication timing is only the beginning, because habit number 6 is something you're probably doing right now, sitting there reading this. And it's not just passively risky, it's actively building clots inside your body in real time. Habit number 6 is sitting for extended, uninterrupted periods in the evening before bed. Picture your typical evening. You finish dinner around 6, you settle into your recliner or onto your couch, you turn on the news, maybe a game show, maybe a movie, and you sit there mostly motionless for 3, 4, sometimes 5 hours straight before shuffling off to bed. It feels like rest. It feels earned. But inside your body, something slow and dangerous is happening. When you sit motionless for extended periods, blood flow in your legs slows by up to 50%. This is called venous stasis, and it's one of the primary triggers for blood clot formation. Your blood is designed to keep moving. When it pools in your lower extremities, platelets begin sticking together. Small clots start forming. Most of the time, your body dissolves them naturally. But in seniors, especially those with existing cardiovascular disease or diabetes, these clots don't always dissolve. They sit there, quietly, growing, waiting. And then you stand up to go to bed. Your blood pressure shifts. Those clots dislodge. They travel through your veins toward your heart, and they can either block a coronary artery directly or trigger a life-threatening arrhythmia, all while you were just watching television. Research from the American Heart Association analyzed over 8,000 adults over age 45 and tracked their daily sitting time and cardiovascular events over 10 years. The findings were striking. Adults who sat for more than 10 hours daily had a 34% higher risk of heart attack and stroke. But here's the detail most people miss. It wasn't total sitting time that mattered most. It was uninterrupted sitting time. Sitting for 4 straight hours before bed was significantly more dangerous than sitting for 6 hours with movement breaks every 30 minutes. Why does a brief movement break make such a dramatic difference? Because even standing up for 60 seconds, even walking to the kitchen for a glass of water, restores blood flow and resets the clot-forming process. But most seniors watching television in the evening don't move. They sit in one position for hours, and every additional minute of complete stillness increases microclot formation. Do that every single evening for months and years, and you're not building relaxation into your routine, you're building plaques and clots into your arteries. Patricia was 71, a grandmother from Ohio. She wasn't sedentary. She walked every morning, attended exercise classes twice a week. She thought her evening television time was her well-deserved rest after an active day. One Thursday night, she stood up from her chair at 10:45 to go to bed, made it 3 steps, and collapsed. Crushing chest pain, cold sweat, couldn't breathe. Her husband called 911. The hospital found a massive clot in her left anterior descending artery, what cardiologists call the widowmaker. The clot had formed during her 4-hour television session and traveled to her heart the moment she stood up. Patricia survived, but she spent 6 months in cardiac rehabilitation, accumulated over $87,000 in medical bills, and endured a level of fear she describes as never fully leaving her. Her doctor never mentioned this risk after her recovery. There's no billing code for telling patients to stand up during commercials. There's no pharmaceutical profit in movement. The fix is almost embarrassingly simple. Set a timer on your phone for every 30 minutes during your evening routine. When it goes off, stand up. You don't need to exercise, you don't need to break a sweat. Just stand for 60 seconds. Walk to the kitchen, do a loop around your living room. Just get your blood moving. If you physically can't stand, flex your ankles 20 times, contract your calf muscles, shift your weight. The goal is simply to pump blood from your legs back toward your heart. And it works.
Now, let's talk about habit number 5, because this one involves something you probably think you're getting right. Habit number 5 is eating high-sodium meals within 3 hours of bedtime. Let me ask you something honest. What did you have for dinner last night? A frozen meal? Canned soup? Takeout? Restaurant leftovers? A Deliwood sandwich? If you answered yes to any of those options, there's a good chance you consumed somewhere between 2,000 and 4,000 milligrams of sodium in a single meal. That's more than your entire daily recommendation in one sitting. And if you ate that meal after 6 in the evening, here's what happened inside your body. Sodium holds on to water. When you consume a massive sodium load, your body retains extra fluid to dilute it. That fluid goes directly into your bloodstream. More fluid in a closed system means higher pressure. Your blood pressure spikes, sometimes by 20 to 30 points within 2 hours of eating that meal. During the day, when you're upright and active, gravity helps distribute that excess fluid throughout your body. But when you lie down to sleep, the fluid shifts. It pools in your chest cavity surrounding your heart. Your heart is now working harder to pump against increased pressure while you're completely unconscious, unable to feel warning signs, unable to call for help. And here's where it gets truly dangerous. That blood pressure spike peaks between 2 and 4 in the morning, the exact window when most overnight heart attacks occur. A study published in the Journal of the American Heart Association tracked nearly 3,000 adults over age 60 with hypertension and measured 24-hour blood pressure patterns against dietary sodium timing. Participants who consumed high sodium within 3 hours of bedtime had dramatically higher rates of nocturnal hypertensive episodes and over 3 times higher incidence of early morning cardiovascular events. But participants who consumed the same total daily sodium, just finishing high-sodium meals before 5 in the afternoon, showed normal overnight blood pressure patterns and cardiovascular event rates similar to low-sodium consumers. Same sodium, different timing, catastrophically different outcomes. And there's something else that makes this especially dangerous for seniors. After age 65, your kidneys process sodium roughly 40% more slowly than they did when you were younger. The sodium you ate at 7 in the evening is still actively circulating in your system at 3 in the morning when your blood pressure naturally surges. You're layering 2 pressure spikes on top of each other, the dietary spike and the circadian one, and your arteries simply were not built to absorb that combined load indefinitely. Now you might be thinking, I don't add salt to my food, I'm careful. That's exactly the kind of reassurance the food industry wants you to feel. 77% of dietary sodium comes from processed and restaurant foods, not your salt shaker. And the cruelest trick of all is that many of these products are labeled heart healthy because they're low in fat, while the sodium content is quietly buried in the fine print. Robert was 69, a retired contractor from Arizona, careful about his health, took his medications, watched what he ate, or so he believed. His typical dinner was a healthy choice frozen meal with the little red heart on the box. His doctor had told him frozen meals were fine as long as they were the healthy brands. What neither Robert nor his doctor focused on was that one of those meals contained 980 milligrams of sodium per serving, and Robert, like many seniors for whom one frozen dinner wasn't filling enough, typically ate 2. That's nearly 2,000 1,000 milligrams of sodium at 7 in the evening. By 8:30, his blood pressure, normally well controlled at 138, was spiking to 165/95. He never knew because he only checked his pressure in the morning when it looked fine. One Wednesday, he had his usual dinner, watched television until 10:30, went to bed feeling perfectly normal. At 3:17 in the morning, his wife woke to strange sounds. He was having a massive heart attack. The paramedics arrived in 11 minutes. It was too late. Robert died in the ambulance. The fix is not complicated. Stop eating meals containing more than 500 milligrams of sodium after 5 in the afternoon. If you love high-sodium foods, eat them at lunch, when your body has 7 or 8 hours to process the sodium before sleep. For evening meals, focus on fresh vegetables instead of canned, grilled fish or chicken instead of processed meats, whole grains prepared without added salt, and homemade meals where you control every ingredient. Read labels obsessively and ignore words like healthy, natural, and organic entirely. None of those words tell you anything about sodium content. Only the actual milligram count matters. This single dietary timing change, not eliminating sodium entirely, but shifting when you consume it, can drop overnight blood pressure significantly within just weeks, and it costs absolutely nothing. Now, let's move to habit number 4, because this one combines two things that millions of seniors do together every evening without any idea of the danger they're creating. Habit number 4 is combining alcohol with sleep medications or drinking alcohol within 3 hours of going to sleep. Picture a typical evening. It's 8 o'clock. It's been a stressful day. You pour yourself a glass of wine, maybe 2. Then around 9:30, a small nightcap to help you settle in. And then at 10, you take your prescribed sleeping pill or an over-the-counter sleep aid because, let's be honest, the alcohol stopped actually helping you sleep years ago. It just makes you drowsy enough to feel like it's working. You fall asleep by 11, feeling peaceful. What you don't know is that you've just created the precise biochemical conditions for a fatal cardiac arrhythmia. Alcohol is a cardiovascular depressant. In the first 2 to 3 hours after drinking, it lowers your heart rate and blood pressure in a way that feels relaxing. But 4 to 6 hours after your last drink, your body rebounds hard. Your sympathetic nervous system, your fight or flight response, surges back with force, spiking your heart rate and blood pressure by 30 to 40 points in the middle of the night.
Now, add sleep medication to this rebound. Whether it's prescription Ambien, Lunesta, or over-the-counter Benadryl or even melatonin in higher doses, these drugs suppress your brain's ability to regulate heart rhythm. Normally, if your heart rate becomes erratic or too fast, your brain detects the problem and automatically corrects it. Sleep medications dull this protective mechanism. Your brain doesn't notice. Your heart starts beating irregularly, and nothing in your unconscious body is equipped to stop it. This combination, alcohol rebound plus medication-induced cardiac monitoring suppression, creates conditions for what cardiologists call sudden cardiac death. Your heart goes into ventricular fibrillation, an erratic quivering that cannot pump blood. You're unconscious from the sleep medication, so you don't wake up. You don't feel chest pain. You don't call for help. You simply stop breathing quietly, while everyone in the house assumes you're sleeping peacefully. A 2021 study in the European Journal of Preventative Cardiology followed nearly 5,000 adults above 60 who used prescription sleep medications. They divided participants into 3 groups: sleep medication only, sleep medication plus regular alcohol, and neither. After 7 years, the medication plus alcohol group had 73% higher cardiovascular mortality compared to the control group. And the relationship wasn't linear, it was exponential. 1 to 2 drinks plus sleep medication doubled the risk of cardiac death. 3 or more drinks plus sleep medication quadrupled it. 84% of those deaths occurred between 2 and 6 in the morning during sleep from arrhythmias that never woke their victims. Autopsies showed no massive blockages, no obvious structural damage, just hearts that stopped beating correctly because the biochemical environment made it impossible for normal rhythm to be maintained. Margaret was 74 years old, vibrant, from Wisconsin. She'd been taking Ambien for insomnia for 8 years. It worked well. She also enjoyed a glass or two of red wine with dinner, something her doctor had mentioned could be heart-healthy in moderation. One Friday night, she had friends over. They opened a second bottle. Margaret had 3 glasses over the course of the evening, not enough to feel drunk, just pleasantly relaxed. She took her usual Ambien at 10 and was asleep by 10:30. Her husband woke at 6 the next morning. Margaret wasn't breathing. She had been dead for several hours. The autopsy showed no heart attack, no stroke, no embolism, just sudden cardiac death due to arrhythmia. The medical examiner noted the Ambien and alcohol in her system, but described it as an unfortunate, unforeseeable interaction. Unforeseeable, despite being documented in the medical literature, despite being mentioned, buried in the medication insert, just not explained in a way any real person would hear and remember and take seriously. If you take sleep medication, the rule is simple and non-negotiable. No alcohol on nights you take sleep medication. Not 1 glass, not half a glass. The risk is not worth it. If you drink alcohol, wait a minimum of 8 hours before taking any sleep medication. If you find that you rely on both alcohol and sleep aids to function at night, that pattern itself is a serious medical situation that needs professional attention. Better still, work toward eliminating both. One patient who stopped his nightly 2 glasses of wine plus Ambien routine saw his resting heart rate drop from 78 beats per minute to 62 beats per minute within 3 weeks. His overnight blood pressure normalized. He told me he felt genuinely rested than he had in years. He'd assumed those habits were helping him. They were doing the opposite every single night, slowly and silently. Now let's talk about something that almost no one considers a cardiac risk, but the research is startling. Habit number 3 is going to bed dehydrated. When did you last drink a full glass of water after 6 in the evening? Most seniors don't, and the reason is completely understandable. They're afraid of waking up multiple times to use the bathroom, so they cut off all fluid intake after dinner. Maybe a few sips when they take their evening medications, but that's it. By bedtime, they're already mildly dehydrated. By 2 in the morning, after 3 or 4 hours of sleep with no fluid intake, their blood has thickened considerably. Here's why that matters so much. Your blood is approximately 92% water. When you're dehydrated, that percentage drops, and the effect on blood viscosity, on how thick and slow-moving and sticky your blood becomes, is dramatic. Thicker blood flows more slowly through arteries that are already narrowed by decades of plaque. It's far more likely to form clots. Platelets stick together easier. And when your blood pressure surges during that early morning cortisol spike, thick, slow-moving blood in narrowed arteries is precisely the environment in which heart attacks happen. A study published in the American Journal of Epidemiology followed over 20,000 adults above age 55 for 12 years and measured hydration status at bedtime against cardiovascular events. Participants who went to bed dehydrated had a 43% higher risk of heart attack during sleep, a 52% higher risk of stroke, and a 38% overall cardiovascular mortality. But here's what makes this especially painful. Most seniors don't know they're dehydrated. After age 65, your sense of thirst diminishes by roughly 40%. You can be significantly dehydrated and feel completely normal. Your body is silently thickening your blood every night, and no one is telling you about it because there's no drug to sell you. There's no procedure to bill for. There's just water, which is free and therefore of no commercial interest to the people who profit from your cardiac care.
James was 76, from Texas. He was so concerned about nighttime bathroom trips that he had stopped drinking any fluids after 4 in the afternoon. His urine was dark yellow every evening, which he'd been told was normal for his age. It wasn't. One Tuesday night, he went to bed at his usual 10 o'clock after consuming maybe 12 ounces of water over the entire day. At 3:42 in the morning, his wife heard him gasping. By the time she turned on the light, James was unconscious. Paramedics worked on him for 37 minutes. They got his heart beating again, but the oxygen deprivation had lasted too long. His blood work showed severe dehydration and markedly elevated blood viscosity. The clot in his right coronary artery, his cardiologist told the family, was the consistency of jelly, far thicker than anything they normally saw. James never regained consciousness. He died 8 days later, and every person in that hospital knew, even if they never said it out loud, that this didn't have to happen. The solution is not about drinking more water before bed. It's about front-loading your hydration during the day. Drink 16 to 20 ounces of water within 30 minutes of waking up. Sip water steadily throughout the day, targeting roughly 64 ounces total by 6 in the evening. After 6, limit intake to small sips as needed, keeping total post-6 consumption under 8 ounces unless you've been physically active. About 90 minutes before your target bedtime, drink 4 to 6 ounces of water. That's late enough to hydrate you through sleep, but early enough that you'll urinate once before getting into bed and likely sleep through the night. Make sure your morning urine is pale yellow. If it's dark, you're not drinking enough during the day, and your blood is thickening every night while you sleep. This one habit change, properly timed daytime hydration, could be protecting your heart in ways you've never been given the opportunity to understand. Now, let's talk about habit number 2, because this one surprises almost everyone when they hear it. Habit number 2 is sleeping on your right side or on your stomach. Think about how you slept last night. Were you on your right side, face down, curled up tightly? If you were, you spent 6 to 8 hours compressing the very structures that keep blood flowing to your heart and brain. When you sleep on your right side, your heart, which sits slightly left of center in your chest, is compressed against your rib cage. This compression reduces the volume of blood your heart can hold in each pumping cycle. Simultaneously, the inferior vena cava, the major vein that returns blood from your lower body back to your heart, runs along the right side of your spine. Lying on your right side compresses that vein against your backbone, reducing the volume of blood returning to your heart, forcing it to work harder to maintain adequate circulation. Over 6 to 8 hours, researchers estimate this increases cardiac workload by approximately 23%. For seniors with existing heart disease or reduced cardiac function, that additional nightly strain is genuinely dangerous. Stomach sleeping is worse still. Your neck must twist to one side to allow breathing. That twisting compresses the carotid and vertebral arteries, the primary vessels carrying blood to your brain. Doppler ultrasound studies show that neck rotation beyond 45 degrees reduces blood flow through these arteries by up to 42%. Stomach sleepers typically rotate their necks 60 to 80 degrees every single night for hours. Many seniors who sleep on their stomachs wake up feeling foggy, dizzy, with headaches they've accepted as normal, never connecting them to the position they spent the night in. A study from the Journal of Clinical Sleep Medicine tracked over 1,000 adults above age 65 with diagnosed cardiovascular disease and monitored their sleeping positions throughout the night. Right-side sleepers showed 29% higher rates of nocturnal cardiac arrhythmias and 41% higher rates of overnight blood pressure elevation. Stomach sleepers showed 48% higher rates of transient ischemic attacks or mini strokes during sleep. Left-side sleepers showed the best cardiac output, the most stable overnight blood pressure, and the lowest rates of all these events. The mechanism is pure physics. Your heart is on the left side of your chest. When you sleep on your left side, gravity assists blood in returning to your heart. Your aorta, the main artery, curves naturally to the left, meaning left-side sleeping reduces the angle your heart must pump against. It's not complicated. It's geometry working in your favor instead of against you. David was 68, a former postal worker from Oregon. He'd been a stomach sleeper his entire life. His wife joked that he looked like a crime scene victim every morning, face down with his arms above his head. For the last year before his stroke, David had been waking up with headaches and blurry vision for the first 30 minutes of each morning. He mentioned it to his doctor. Blood work came back normal. A CT scan looked fine for his age. His doctor suggested it might be allergies or mild sleep apnea and prescribed a nasal spray. Nobody asked about sleeping position. 6 months later, David had a massive stroke at 4:37 in the morning. His wife woke to strange sounds. He was trying to speak, but only garbled noises came out. His right side was completely paralyzed. The stroke was in his left hemisphere, caused by reduced blood flow from years of nightly arterial compression. The damage had been building slowly, visibly on his arterial imaging. His neurologist told me plainly, if someone had taught him to sleep on his left side years ago, this probably would not have happened. To make the change, place a body pillow against your back when you lie on your left side. It prevents you from rolling during the night. Elevate your head slightly, keeping it at roughly a 30-degree angle, which reduces cardiac pressure and supports breathing. Keep your right knee slightly forward with a pillow between your knees to prevent hip strain that might cause you to shift positions unconsciously. If you truly cannot sleep on your left side due to pain or a medical condition, sleep on your back with your head elevated and a pillow beneath your knees, never on your stomach, and never with your head tilted to the side. One patient who switched after 50 years of right-side sleeping saw his morning blood pressure drop by an average of 14 points over 2 weeks. His headaches disappeared entirely. He said it was the simplest change he'd ever made, with the largest payoff he'd ever seen. And now we've arrived at habit number 1. This is the one that genuinely keeps me awake at night. This is the habit that, based on the evidence I've reviewed, is responsible for more preventable senior deaths during sleep than any other single factor. Habit number 1 is taking certain medications at bedtime that should never be taken before sleep. I'm talking specifically about first-generation antihistamines like Benadryl and diphenhydramine, which are found in nearly every PM sleep product on pharmacy shelves. I'm talking about certain antidepressants, particularly tricyclics. I'm talking about certain short-acting blood pressure medications and certain over-the-counter pain relievers combined with other cardiac drugs. What all of these medications share is something called anticholinergic activity. They block acetylcholine, a neurotransmitter that plays a critical role in regulating heart rate and rhythm. When you block acetylcholine, your heart rate loses its ability to respond flexibly to changing demands. Your cardiac conduction system, the electrical network that coordinates your heartbeat, becomes less responsive. Your blood vessels lose some of their ability to dilate when circulation needs to increase rapidly.
During the day, when you're awake and moving, your body has compensatory systems that can partially offset these effects. But at night, during deep sleep, those compensatory mechanisms quiet down. Your heart is running on minimal conscious oversight. And then, between 3 and 4 in the morning, your body releases that cortisol and adrenaline surge to prepare you for waking. Your heart needs to respond by increasing its rate and output, but the medication is blocking the signals. The heart tries to speed up, but cannot coordinate the rhythm properly. It develops an arrhythmia. In serious cases, ventricular tachycardia or ventricular fibrillation, rhythms that cannot sustain life. You're unconscious, you feel nothing, you don't gasp, you don't call out, you simply stop breathing. And in the morning, your family finds you and is told it was a peaceful passing in your sleep. It was natural. It was his time. A study published in JAMA Internal Medicine analyzed 10,000 sudden cardiac deaths in adults over age 65 and examined medication usage in the 12 hours before death. 58% of victims had taken at least one medication with strong anticholinergic effects within 4 hours of dying. 73% of those deaths occurred between 2 and 6 in the morning. Most victims had shown no symptoms the previous evening. When researchers examined medication timing, they found a striking pattern. Taking these medications in the morning carried standard cardiovascular risk. Taking the same medications at bedtime was associated with 3.7 times higher risk of sudden cardiac death during sleep. And here's the piece that I find most maddening. Many of these medications are specifically prescribed to be taken at bedtime because they cause drowsiness, and drowsiness at night seems logical. But that drowsiness is a direct consequence of the same central nervous system depression that suppresses cardiac regulation. The drug that makes you sleepy is the same drug that interferes with your heart's ability to keep itself beating normally through the night. This one is deeply personal for me. My uncle Richard was 72 years old, a Vietnam veteran, healthy, active, swam every morning. He had trouble sleeping, which is extraordinarily common among seniors, and his doctor prescribed him trazodone, an antidepressant commonly used off-label for insomnia. Take it at bedtime, the prescription said, helps with sleep. What it didn't say was that trazodone carries significant anticholinergic effects, particularly in elderly patients. What it didn't say was that it can interact dangerously with the amlodipine Richard was taking for blood pressure, also at bedtime, also as prescribed. Richard took trazodone every night for 3 years. It worked perfectly. He fell asleep within 30 minutes and slept 6 to 7 hours straight. One Saturday night, he took his dose at 10, went to bed at 10:30. My aunt woke at 6 in the morning. Richard wasn't breathing. He'd been dead for hours. The autopsy showed no heart attack, no stroke, no embolism, just sudden cardiac death due to arrhythmia. When I reviewed his records, I saw the interaction immediately. 2 medications with overlapping cardiac suppression effects, both taken at bedtime, both as prescribed. I contacted his doctor. Do you know what she told me? She said she'd prescribed that combination to dozens of patients, and this was the first problem she'd encountered, the first problem she knew about. Richard didn't die of natural causes. He died because a system built on prescribing medications rather than preventing disease failed him completely. Starting tonight, take out every medication you take, prescription and over-the-counter, and look for diphenhydramine, doxylamine, amitriptyline, nortriptyline, or any medication listing anticholinergic effects. Check what time you take each one. If you're taking any of them within 4 hours of sleep, speak to your doctor about switching to alternatives without anticholinergic properties, moving the timing to earlier in the day, or finding non-pharmaceutical approaches. Safer alternatives for sleep include low-dose melatonin between 0.5 and 1 milligram taken 2 hours before bed, and magnesium glycinate 400 milligrams taken an hour before sleep. Neither carries the cardiac risks associated with antihistamine-based sleep aids. One patient who had been taking diphenhydramine every night for 6 years switched to 1 milligram of melatonin after I explained the risks. Within 2 weeks, his heart rate variability improved measurably, his morning blood pressure normalized, and he reported sleeping more deeply and waking more refreshed than he had in years. He told me he had assumed that because he could buy it without a prescription, it must be safe for regular use. That assumption is exactly what the industry relies on. Over-the-counter does not mean safe for elderly patients on a long-term basis. Your heart doesn't care what the label says. It responds to the chemistry every single night, whether you know it or not. So, here's where we stand. 7 habits. Medication timing that leaves you unprotected during your most vulnerable hours. Evening sitting that builds clots in your legs while you watch television. High sodium dinners that spike your blood pressure in the middle of the night. Alcohol combined with sleep medication creating the conditions for fatal arrhythmias. Daytime dehydration that thickens your blood until it clots. Sleeping positions that compress your heart and arteries for hours every night. And bedtime medications that interfere with your cardiac autopilot at exactly the moment your body needs it most. None of these are mysterious. None of them require complicated interventions. They are all addressable starting tonight with information, commitment, and a single conversation with your doctor. The tragedy is not that these risks exist. The tragedy is that they've been allowed to remain invisible to the people most endangered by them. You now have the knowledge. Move your blood pressure medication to bedtime and have that conversation with your doctor this week.
Set a 30-minute timer during your evening television and stand up when it goes off. Stop eating high-sodium processed meals after 5 in the afternoon and read every label with actual attention. If you take sleep medication, stop drinking alcohol on those same nights, full stop. Drink the water your body needs during the day and stop punishing yourself after 6 just because you're afraid of the bathroom. Sleep on your left side and put a body pillow behind you to stay there. And audit every medication you take at bedtime, every single one, and ask your doctor directly about the anticholinergic burden and cardiac interaction risks. These are not difficult changes. They require no special equipment, no expensive supplements, no prescriptions. They require only that you know what you're dealing with and that you decide your life is worth the effort of changing a handful of habits. Your heart has beaten approximately 2.5 billion times since the day you were born. It has never asked for a break. It has never stopped working on your behalf. It has done everything right, even while the world around it has been getting things quietly wrong for years. The least we can do, the absolute minimum we owe it, is give it the right conditions to keep going. You have that power. You have that information now, and no one, not a pharmaceutical executive, not a complacent physician, not a system that profits from treating disease rather than preventing it, has the right to take that from you.